Hi, I'm Dr. Stephen Ferguson. I have a large medical practice in eastern North Carolina, a little town called Powellsville. Today I'm going to talk a little about Suboxone. I use Suboxone in my practice. I don't work for Suboxone. I'm not a distributor of Suboxone, but it's one of the medications I use to help patients with addiction. Suboxone is a drug that helps a person that's become addicted to opioids. And what are opioids? Opioids are the Percocets, the Vicodin, the methadone, the heroin. Those are opioids. And when a person becomes addicted to those things, what happens is they can't get off of those things. So by the time they get to a place we're called addiction, they come see me. And when they come in to see me, they usually hit about rock bottom. Most times, just about everybody they know has kicked them to the curb. They usually don't have any more body else that will lend them money. The relationships, the parents, the children, the job, all those relationships are usually way down in the basement. And so what I start off the conversation with is we have to have a relationship of trust. I tell them, I'm going to believe everything you tell me till you tell me something's not true. We have to build a relationship on trust. And what I try to do is instill in them day one that I'm here to help. We're going to make this thing work. We're going to have a relationship, a great relationship, get them off the drugs. But they got to come in telling the truth. Telling the truth is critical. And because, you know, so many times by the time a person becomes addicted to drugs, they're living a lie. They're waking up, they got to take drugs to even get back to even close to baseline. They're no longer getting high. It's just able to function by taking the drugs first thing in the morning, first thing in the afternoon, first thing in the evening. And by that time, they're lying for existence many times because they got to get the drugs. And the drugs are expensive. So, you know, many of the patients I see have habits in excess of $300 or $400 a day. Well, that's a lot of money. Where do you get all that? Well, lie, steal, cheat, however, whatever you can do to get that. So that's why it's so important when you first see your healthcare provider, such as someone like myself, that you go in with trust. You've already opened the door, so you already said, I want to get help. So that's the first step. And now you're in the office, you got to be honest. You got to make it straight. You got to be completely truthful. I've had a few patients that try to hoodwink me and give me somebody else's urine. A few patients that'll come in and tell me that, you know, the dog ate the medicine or that something else happened. But, you know, doctors are pretty smart. That stuff doesn't really fly. You're smart too. And, you know, come in and tell the truth. I tell my patient, if you tell me the truth, we can make this happen. If you're telling me something's not true, it's going to be difficult because, you know, it's easy to figure out. So Suboxone is a good drug out. It's one of the only drugs right now to treat opioid abuse in a real successful way. So I encourage you, those of you who have addiction and you need something to help you get off that process, off that revolving merry-go-round that you're on, Suboxone might be the way. And I'm more than happy to see patients who need help with their substance abuse. I'm located in a small town called Powellsville in northeast North Carolina. You can find me on the web at AskDrFerguson.com. You can find me on the web at AskDrFerguson.com/FamilyCareSpecialist, or you can just call my office at 252-332-6484. Be happy to see you.